Hey everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormonal optimization, hormonal fitness, and muscle medicine. Thyroid Thursdays, we talk a lot of things about metabolism and thyroid. So, a very short one today. Just want to talk about subclinical hypothyroidism. The last couple of times I talked about primary, secondary, tertiary types of hypothyroidism. Basically, when lab markers can be normal, as we talked about before, is not optimal. And someone, for example, if they look at their lab work, their TSH is normal, even if their T3 and T4 is normal, but they're having all the symptoms. They're tired, they're gaining weight, their cholesterol is high, their dry hair, dry skin, constipation, menstrual irregularities, headaches, many other things, many other symptoms of hypothyroidism or subclinical hypothyroidism needs to be treated. It's not just about treating the symptoms. There's a lot more to it, and I'll do more detailed videos on this in the future, but the biggest ones I want to focus on are the health benefits, right? A lot of clinical studies and experience from physicians for decades and hundreds of years have shown that when subclinical hypothyroidism is not treated, when the thyroid is not optimal, long-term complications can ensue. The biggest ones, of course, are atherosclerosis, coronary artery disease, elevated cholesterol, elevated triglycerides, and this goes on for a long, long time, predisposes to cardiovascular disease, metabolic syndrome, diabetes, etc. So patients obviously have thickening of their arteries, thickening and stiffening of the blood, the vasculature. They can have symptoms, and many symptoms related to accumulation of mucin and basically decreased blood flow to the extremities, the arteries, the nerves, all the peripheral organs. Of course, can cause many things down the road. And I'll go over some other things that can come up that a lot of people don't think about with hypothyroidism. But again, just gleaning knowledge from through the centuries of symptoms that were treated, symptoms and things that can be caused by low thyroid. Pretty astounding. So, but these are the biggest ones, right? And then we talk about bone. Women and men losing bone strength, bone density, and getting osteoporosis, and of course symptoms. A lot of times patients have all the symptoms even though the labs are normal, and they need treated, right? So, again, the whole point of it is basically that we have to be very cognizant of symptomatology and treat the patient, not the lab work, because a lot of patients will have these things and go on. If they're not treated down the road, they can have cognitive problems, they can have bone problems, heart problems, lipid abnormalities, inflammation, worsening symptoms, and much more. So it's not just about immediate treatment. It is, but of course we have to treat these long-term things. That's what it's all about, the preventive personalized medicine approach that I take and that a lot of my colleagues take, is preventing all these things from happening in the first place. Again, living better, living stronger. That's what I want my patients to live great, live good, and live to give. That's what, optimizing our health so we can feel better about ourselves and give back to those around us, be better at everything that we do. So guys, like this post, share my pages, reach out to me, let me know what you want me to talk about. I will hit it. We'll talk Thyroid Thursday, Testosterone Tuesday, and every other thing in between. So I'm doing a little dance because I'm excited. I love this stuff. So reach out to me, guys. Have an awesome weekend, and we'll talk to you soon.